Welcome back, everybody, to Your Governance Matters. This is where partners from the Cultural Governance Alliance are helping conference delegates explore problem solving, planning and actioning on your own governance journeys. I'm Jonathan Mays from Claw Leadership. I am a white man in my 40s. I have dark hair with an alarmingly grey beard and dark glasses, and I'm in an office. I'm delighted to be able to introduce you to the speakers for our next session. They've been pulled together by our partner organisation, the Good Governance Institute. They're going to be looking at reinventing the board meeting in order to create more space for genuine, free-flowing discussions. Is that right? Am I using the wrong script here? Andrew, tell me.
You're not looking at
wrong script. Ignore that, because I've got somebody else's script. So, from Good Governance Institute, talking about burnout, we have Andrew Corbett-Nolan. Welcome, Andrew. It's lovely to have you with us.
Hello.
From Imagining, I'm going to get this wrong, sorry, Margaret, Imagine Independence, isn't it? We have Margaret Hanson, who is CEO. Welcome, it's nice to have you with us.
Thank you.
And Deputy Chief Nurse in Barking, Havering and Redbridge University Hospitals NHS Trust, James Avery, who I think is partially with us visually, but definitely with us in audio. Our three speakers are going to be looking at burnout and learning from NHS and thinking about how that relates to governance practice. It's really a great pleasure to have you with us. We've got about 55 minutes. We'll very much want questions from the floor, so do please use the chat function to ask questions to any of our speakers. Andrew, over to you.
Thank you very much indeed, Jonathan. I'm Andrew Corbett-Nolan. I'm the Chief Exec of the Good Governance Institute. We were one of the founding members of the Cultural Governance Alliance, very pleased to do so too. We do what it says on the tin, we're a Good Governance Institute, but almost all our work is with public and third sector organisations, and we've got a very large health practice, so more than 50% of what we do in one way or another is concerned with health and well-being in one way or another. GGI chairs and convenes a number of networks, and on a weekly basis, for example, we have a get-together of all any NHS non-executive can dial in. And what's been really interesting is over the last 18 months, hearing about what different boards are doing in connection with burnout occasioned from the pandemic. Part of the pleasure of my job is that I get lots of calls in the evening from people we've worked with, and certainly during the pandemic, the last 18 months in one way or another, the character and nature of these calls has very much changed. And it's very clear that people running large, complex public sector organisations and third sector organisations, which are always complex in different ways, have really had to find ways of living with what would have seemed intolerable levels of stress. So we got two very different organisations that GGI work with in the health space, who are going to share some thoughts and insights today. I'll let them introduce their organisations as well, because I think that will be handy for you to get the context. But we'll start off with James in Barking, Havering and Redbridge University Hospitals NHS Trust, where it's I think I'll also say that James is particularly fond of the arts, actually, and is patron of the Royal Shakespeare. So, James, over to you, and maybe you talk a little bit about Barking and then your thoughts.
James, could you just share audio and video again, and then we'll be able to hear you. Top right.
James is in Queen's Hospital, Romford. The roof is leaking, and he's got a wet back, just to let everybody know. There you are. He looks for peace. He looks for part, doesn't he? Hello, James.
Hello, and thank you. Yes, resilience. Top of water may be coming through, but we're fine. And actually, in terms of burnout, the arts I find as absolutely essential in terms of that, which we'll come on to talk about in terms of the antidote an antidote and the wisdom and the relaxation and the joy. So thank you. I'm deputy chief nurse. I'm improvement director also for emergency care, working across both emergency departments that's in Romford and also at King George Hospital in Ilford as well. And particular interest around governance, but also in terms of leadership, and also of the well-being and support and leadership and the effects that can have in terms of achieving really good outcomes for staff and for patients as well. So it's very good to be here.
Okay, so would you like to introduce yourself, Margaret, as well?
Yeah, I'm Margaret Hanson, Chief Exec of Imagine Independence. We're a third sector social care provider. And we help with the arts as well, in that we are based on Hope Street, which is a really great place to be in Liverpool. That's where we started. And we're next door but one neighbours with the wonderful Everyman Theatre. So we live in value the arts, and we have some thinking going on with our new neighbours and others.
This is like the wreck of a Hesperus. Am I the only one having difficulty hearing, Margaret? Did everybody
I had
have
some difficulty with audio there, Margaret.
Okay.
Might just need to you to give a refresh to your browser there and then rejoin with audio and video.
So okay, so let's start off with Margaret's doing at you, James. I mean, talk about how, if you can sort of just give people a little pen portrait of what the burnout factor has been at a busy NHS hospital in East London, and what you have been doing about it. With your microphone on.
Okay, good. Hello. So within the last 19 months, we have faced enormous pressures within the NHS. We've had to scale up to deliver a level of clinical skill that we have never done before. All clinical staff and all staff across the organisation have had to respond to the challenge in COVID, and we've all had fear in terms of contracting COVID ourselves, but also staff that work within this organisation that may be within an admin role, that may be clinical but within an admin role, clinical staff that work in what could be a low acuity area, patients that are not particularly unwell, have had to face that challenge in terms of their own personal concerns, but also undertake training and also work within areas, within new areas of care. So an enormous pressure. 50% of NHS staff report, there's 50% more stress reported in NHS staff than there are compared to the standard workforce. One in four of our trainees will report burnout. In burnout, we mean in sense of that's that level of exhaustion, in a feeling that there is pressure that individuals feel that they cannot manage in terms of their workplace experiences, and that impacts on their daily lives in terms of their access to friends and family and doing the things that they enjoy. The consequences of course, sickness, turnover of staff, and the effects of tiredness are quite clear in terms of performance. There is a wealth of research in respect to the effects on patient safety of exhaustion as well, and significant links. The consequences of moral distress faced by individuals, in which people feel that they cannot do the job that they need to do, is clearly significant and has a very significant effect on that. So it is an enormous, and if it's not on the agenda of leaders, it absolutely needs to be. And within my own and with my colleagues' agenda is absolutely on the agenda to both recognise that as a leadership obligation, to be acting on it, to recognise it, to see that within colleagues and to respond, and to also recognise what are the key interventions. There's a great deal of work on this, and I think this is very applicable across all industries in terms of having structures to support staff. So it comes from the very basic principles about how you're set up in terms of workforce. Do you have the right staff with the right skills in the right place at the right time? Because if you don't, you will be stressing your staff and your service will be poor. You will face a poor poor quality. So some of those quite basic principles as a leader are absolutely essential to have in place. The environment that individuals work in is absolutely key as well, in terms of the basic factors, in terms of lighting, access to rest and to food and drink. These are all quite fast-paced fundamental things in all issues across outside of it in the other industries, but in the NHS, windows and coffee rooms are not taken for granted. So, but these are all enormously working patterns too, in terms of the areas that we provide as well, and the hours that people work. There is European legislation, however, that's often can be breached and obviously no longer enshrined. But that's an absolutely key. But to come on to some of the interventions that we've undertaken, we've done a great deal of work with psychologists who have been really, really helpful, and grateful to Captain Tom and his enormous amount of money raised in terms of the intervention of the British Association of Psychologists, who have spent time with us, working and providing sessions to colleagues to talk through their experiences as individuals and as teams. The use of Schwartz rounds in which individuals can gather and talk about these areas. Some of the key parts, though, aside the aspects of psychology, are actually doing things differently. So actually providing training in a seriously detailed way to individuals, because a psychologist is helpful, but actually far better to relieve that principle of burnout, or even the risk of burnout, by actually providing adequate training and supervision and mentorship through that process as well. Recognition of the compassion and care that's required, and making sure that the structures are there and the support to colleagues are in place are absolutely key. We sampled and we spoke to lots of staff around their experiences throughout the beginnings of COVID in the first and in the second wave, and we learnt, and I think that's a key thing to underline in here, is absolutely to listen and to learn. Listen to what colleagues are telling you and what are the areas that stress them, and the areas that concern you, and actually to respond to them. Within my own department, our colleagues were hugely concerned about the levels of aggression and violence from members of the public. Looking to the evidence base that's really clear on that, there are some key things that can be done. So the introduction of additional and more prompt security, the introduction of body-worn cameras, which is quite frightening that nurses are wearing body-worn cameras, but they are. Those cameras make a huge difference in terms of individuals that are perpetrating aggression and violence see themselves on a screen and cease their behaviour. That's really positive, and our colleagues report an enormous improvement in that they feel listened to, and also that stressor in their life has been reduced and their safety is improved. So very much an underline in terms of listening and acting on what colleagues are saying. And I think as a senior leader, taking that responsibility very seriously in terms of addressing the things that you can, but also to engaging with the board in terms of being clear with them about the risks that we're facing and the interventions that are required, which I think we have to some extent had some success and positivity. But however, we are in what is the next wave, and we are in winter, but we are thinking we're in a slightly more prepared, and we are valuing our colleagues very much, and the mantra of being kind, which I think is all important within this process. So hopefully that's of some use in terms of a bit of insight to ourselves and some of the things that we're doing.
Well, thank you, James. We'll come back with questions and things like that as well. So if I can now turn to you, Margaret, if you want to say your piece too.
Yes, can you hear me now?
Yes, Margaret.
Excellent. That my anxiety's just dropped a few notches in that case. So as I was saying earlier, when we had the technical hitch, I'm proud to lead an organisation called Imagine Independence. We're based on Hope Street in Liverpool. It's where we started, which is a wonderful address to have for an organisation that supports people who have got mental illness, may have a learning disability, may be neurologically diverse, and or have come into contact because of offending behaviour with the criminal justice system. And we've been doing this work since the mid-1970s. The original mission was to enable people to move out of long stay asylums and to live with meaning in the communities from which they'd been excluded because of very often a social reason or a mild to moderate learning disability, although some of them did have mental illness in its true sense. And we stayed true to that mission to this day, but we do work with a much more diverse range of people, and our footprint is across the Northwest and London. So what I want to share with you is our perspective, some of which is similar to James's story, but other bits of it I think will be very different because we're not the NHS. Working in social care generally is not such a valued space in terms of public perception of what we do, if they have a perception, and particularly in the third sector part of the social care world, we are not seen for the work that we do, which is very often working at the cutting edge of new ways of delivering services and transforming people's lives with them. Just a little bit of background. I'm a public health practitioner by both profession and inclination. And so the pandemic for me as a leader in an organisation of roughly 400 staff has been an opportunity to really practice what I preach and think. Who in 2019 actually defined burnout as an occupational phenomenon. So this predates the pandemic, but actually I think the media focus on burnout has increased obviously during the last 21 months. So our learning, well, the first thing was not in the NHS, we were at the back of the line for absolutely everything that was being done by central government in those early phases of the pandemic, and that certainly for staff and the people that we supported made that whole experience worse. We had no PPE. Sometimes it's difficult to remember that first phase, and I think many of us are blocking it out because it was so traumatic. But we had no vaccinations, no PPE, none of the stuff that we take for granted even just 21 months later. And I think we very quickly, both my board and the senior management team within the organisation, got over that feeling of nobody loves us and decided that we needed to make our own weather. So we very much focused on a few areas where we could take back some of that control that we needed in order to promote our own health and well-being, and more importantly, that of the people that were there to support. The work that Michael Marmot did when he was less well known in his very early research around autonomy and its role in creating well-being informed some of the decisions that we made. So we've very much focused on stripping out some of the things that you would do in normal running and didn't need to do, both in terms of governance, but also in how we did our day-to-day work. And we gave back to staff the autonomy to create something that was different, but which met the needs of the people they were supporting. That, I think, is important in the context of the people that we work with are probably, certainly before the pandemic, some of the most excluded within our communities. And so for them, having lived for at least a good chunk of their lives in locked environments, whether that was in a prison or in a hospital setting, to actually be told that they had to be locked down again was re-traumatizing. I think the other thing was that many of our staff work in low working situations, and so where in hospital settings and other places there was teamwork going on, for many of our staff, they were out there on the front line doing it alone, and that, you know, was something, a risk that we recognised. So communication for us was key. Focusing on what mattered and stripping out all those bits that, you know, sort of didn't need to be done, that annoy people on a day-to-day basis. Focusing risk assessments and interventions on those things that had changed as a result of being in a pandemic situation. Supporting people, both the people supported and our staff, to develop autonomy and creativity. Not dictating how they supported people, but doing what worked. We were very fortunate in that we were offered, which we didn't have before, a pro bono employee assistance program, and that has been such a gift to our staff because they're the kind of things that you don't normally get if you work in the third sector. We brought in staff recognition awards because we weren't getting that public message that we were valued, but actually we needed to do that for ourselves. So we've been really keen on making sure the staff are well rewarded, that they took their holidays, because there was a temptation for people to bank. We have generous holidays in our organisation to just bank it, and then, you know, of course, the Prime Minister said, well, you can carry it over. So making sure people got their rest days, got their holidays so they could recharge. And one thing that I think we do really well is we deliver and also spread the word about mental health first aid. So we train people in this, and we do have mental health first aiders within the organisation. We made sure that our staff and our service users had as many front doors into the support they needed as we could possibly provide, because everybody finds their way to what they need in a different way. So that was all the early door stuff. I think I would close by comparing that and that feeling that we're all in this together to where we are today. And I think we need to use the learning from the first two lockdowns and first two waves of the pandemic to get through the next 2 months. Because I'm trying to be an authentic leader with the staff and not overpromise that it's going to be any easier over the winter period, because I think that would be wrong. But recognising that for the staff, and I think that's probably the same for colleagues in the NHS, we're now in this Alice in Wonderland situation where when they come into work, we quite rightly expect them to be in full-blown pandemic mode, to be vaccinated, wear the PPE, do all the infection prevention bits. They go home and the world's carrying on as though nothing's happened. And there must be that sort of dissonance between their work experience and their other life. And trying to get a balance between those two sets of experiences, I think, is something that we need to address and recognise. So I think my message would be, listen to people, communicate well, clear out the junk that you don't need, be flexible and agile in your responses to people, and do what you can. And model the way, and it is trite to say that, but it is more important than ever at this point in time.
Well, thank you very much. There's certainly some common themes there. Now, what would be great is to hear what some of their colleagues might be interested in exploring with James and Margaret, and probably the best way of doing that, unless Jonathan tells me otherwise, is to say something in the chat. So, and please do. This is all these things are much more interesting if it's not a monologue. So while you are being good colleagues and writing something in the chat, I'll ask one question. Margaret, you used the term mental health first aider. Could you just explain what that is?
Yes, Mental Health First Aid England have been running this programme, which is a validated way of working with groups of non-mental health professionals to learn about those interventions, those things you can do as an individual, whether that's as a colleague or as a family member, wherever you live your life, to support other people and yourself to maximise your mental well-being. And part of the programme, there is a subsection of it which is to talk about suicide prevention, but it is giving people an understanding of how mental well-being is created and how we can have conversations, good quality conversations about mental health. And that often comes in short courses, or it can be a full-blown 2 days, and you get accreditation according to what you do. We used it internally so that we have about 16 people across all of our sites who have done the full course and are available to their colleagues. But equally, to do the programme that's promoted by NHS, which is the just suicide awareness and suicide prevention taster session. So it's really very, very accessible.
Margaret, sorry to jump in again. We're getting the same audio issues as we had before. Could I suggest, would you mind trying without your headset on, just to see if that makes it any better? Thank you.
So there's a note, which apparently is from me, but it's not. Agree the need to be open and honest with colleagues that this winter will be continually difficult. Do you have any approaches for individuals or teams who feel unable to see beyond this point? Are there ways of supporting colleagues with continued burnout? James, would you start with that, because that is your world, isn't it?
Yeah, I'd say absolutely. Actually, I mean, I think being honest and open with colleagues is absolutely clear. I think burnout can often be described as being stuck in a lift, and you have no button to call for help, and nobody's coming. I think if you know the fire brigade are on their way, feel slightly better. So that's very much about talking with my colleagues, talking about winter and the preparedness, having a professional discussion about the workforce that we need to manage what's ahead of us, knowing that there's not a team coming, but actually we can recruit, we can train, we can buy more equipment. In terms of PPE supplies, what we're doing, we have a thing called a Friday five key things from the week that we share with the team that are really important things that we've been involved in that are important news. All those things are very good, but I think also the visibility of leadership about walking through the departments, which is a great thing I do very frequently, is to actually listen and understand to people's experience. What are the things? Because quite often these are quite tiny, these are quite small things that actually stress people enormously. So, yeah, and the honesty is absolutely clear in terms of what we face. Winter is uncertain. The levels of COVID are quite variable. One of the biggest issues is around delays of discharge in hospital, which particularly around emergency medicine is a challenge to us. But we are heavily expecting a surge in terms of flu conditions. So I think it's absolutely key to talk to people about what those projections, what the public health data is saying, and what are our plans around that. Otherwise, people think, well, we'll just have to try and weather it. And I think we've reached the point in the NHS that, as you'll see, much of the media is saying it can't. The NHS, is not able to tackle it. But what is needed is really clear planning, and as a definite burnout reduction, stress reduction in colleagues is to know that something is know that something is things are happening.
There's Deborah Rees has asked if you could say a little bit more about when stress becomes burnout. So what would you define actually as burnout?
I think there are a range. I think there are a range of there are a range of definitions. I think we are looking at repeated and sustained issues where individuals are unable to recover. I mentioned around moral distress. So there's a lot of evidence that these repeated and sustained pressure in which you're unable to undertake your role correctly or provide the care or service that you wish to. And both the psychological and also the physiological effects of this. So the increased heightened cortisol levels are absolutely clear, and there are physiological effects in terms of initiation of diabetes, of heart disease, high blood pressure are there. So I think we're at a point that's the consequence, but it is exposure to sustained periods of stress, unresolved, that then begin to manifest themselves in both the psychological distress and then the physiological effects as well. Would be. There are a range of them, and I would point very much to Michael West's book on compassionate leadership, which is an excellent text in terms of a collection of evidence and actually real guidance in terms of where to go, and very much underlines that leadership obligation within this subject and on the wider leadership aspect.
Thanks very much, James. How we'll come to Becky's question in a minute, but Margaret, have you anything to add particularly about that?
Yeah, has that resolved the issue? Can you hear me? Excellent. Yeah, I think it's important to say that there are some very clear symptoms which, if you see them, you will recognise them, and you shouldn't ignore them if they're within your colleagues. So it's feeling tired and drained most of the time, cynical and negative attitudes, people saying that they feel detached and alone even if they're in part of a team, self-doubt, procrastination, it takes longer to do things than maybe someone would normally take, and people expressing feelings of being overwhelmed. And I think the thing that I would encourage colleagues who aren't working in a health setting to do is not just ignore it, because it won't go away on its own. And actually, there is a huge risk that it will tip into becoming a serious and enduring mental illness, one of the common mental health disorders such as depression. There are things you can do within the workplace to lessen some of the impacts, and James has referred to some of them. I think doing a stress risk assessment is always a good idea. Doing a well-being plan with somebody, again, we do that as a matter of course, anybody can imagine. But it is knowing when you need to refer that person to professional assistance, because you won't have all of the answers. I think the other thing that you need to do is contextualize what's going on in people's lives outside of the workplace. So before anybody on the call begins to feel a little bit guilty or overwhelmed that it's all originating in the workplace, I think I would also encourage people to talk about what's going on in that home environment, because most of us know that if work's okay and home's a bit rubbish, you can get through. And if work's a bit rubbish but home's great, also you can cope. It's when the two lots come together, as they have during the pandemic, that it really does begin to have a really bad impact on people's mental health.
We'll talk a little bit more about Becky's point in a minute, but I mean, if any of you want to hear more about what some of these things mean, like well-being plans, do just say. And the very serious point that as a colleague, when you see these signs in another, that you do need to act. It is part of being a good colleague and a good employer. And I'll just tell you very briefly a couple of things that we've done ourselves at GGI, which have helped. So we have an etiquette about electronic meetings, and that does include things like cameras on, so that we can actually see people and get an idea, are they, what is their life like? The business about context and understanding the context that your colleagues are in is been absolutely crucial. At GGI, we have a system of 42 of us, so we may be the size of some of the arts organisations. There are 42 of us, and everybody writes a group email every day about what they've been doing. That's really quite important. We've moved to weekly team meetings. We have an hour on Tuesday mornings. During the lockdowns, we also had a Friday evening, 4:30 to 5:30, which was we call it happy hour, and we played quizzes or games or something like that. We've used every opportunity when we are able to meet. That's all the more important. And generally, to get to know your colleagues better than you normally might have. And James used the word kindness. Really, really, really important. Kindness and consideration. So let's pick up Becky's point. So I'd be interested to know how you've consulted with staff. Has it been surveys, meetings? Can you say a little bit more about sessions with the psychologist? So I know the psychologist was from James, but let's start again with Margaret this time. How have you found out about your staff's well-being and health? I should also say at GGI, we did both surveys and groups all the time.
Yeah, so we upped our communications game amazingly. We started newsletters. We made sure that staff could email senior leaders within the organisation, and they did, to raise any issues. We also put into place regular team meetings, team briefs, things that we didn't normally have in place. And they've been really vital in terms of that communication flow, both upwards and downs, because it was very, very important, particularly in the early part of the pandemic, when the messaging coming out of both government and public health England, as was at the time, around what was happening with the pandemic, how we were needing to act to keep both ourselves and the people we supported safe. It was just constant, and they were reinventing the wheel on a daily basis in those early days. And so having those communication channels quite clearly established was vital. We also then, as the first wave calmed down, reached out and started different conversations with staff. So we broadened the scope of what we were talking about to include them in developing what we called our adaptation strategy, which was very much our attempt to signal, both in terms of governance but also practical actions, that there was going to be some, I'm not going to use that horrible new normal phrase, but there was going to be at some point a return to something that was more steady, and that we kept our eyes on that goal rather than just being buffeted on a day-to-day basis, because that didn't really feel very good. And that was an excellent way to actually get staff talking about what mattered to them, where they saw the future of themselves and the people they supported and the organisation. And I think that really helped them. Lastly, we work on our values. Some of the educators were a bit low, so we decided, as we were about to do a business plan for the next 3 years, that we would refresh our values. And that's been an absolutely wonderful experience, because again, it's been talking to people about things other than the pandemic, and I think people that they can talk about what the future is going to be, and have a sense that they're part of shaping that future.
You've gone underwater again, I'm afraid, Margaret. I don't know whether the refreshing will help, but anyway. So James, do you want to talk a little bit? There's a note in the chat from Freya that might be handy. James, do you want to talk a little bit about the work with the psychologists, and also, I mean, it'd probably be helpful for people to understand a little bit about the context of the hospital, and say, you know, for example, how many people work in ED, that kind of thing, so they can get a feel of scale. And
yeah, so as a hospital site just at Queen's, well, across both sites, we've got 1,500 beds, 6,000 staff. The emergency department has 350 nurses, 20 consultants, just over 110 junior medical staff, and obviously medical trainees as well. And that service worked. That service worked throughout COVID in a slightly different way. We had to restructure the department, effectively create what was one ED turned into 2 EDs, because you had a COVID ED and you had a non-COVID ED. So you just can't split things in half and have split the workforce. That was a significant challenge to do across the organisation. The understanding of people's position was through, as Margaret rightly points out, in terms of risk assessments across the whole department, in terms of that workforce. What are the workforce challenges there? That jumps out at you in terms of the risk that you're facing. And then secondly, in terms of talking to people and actually listening to them within their team groups. Also in terms of providing them with a very good rest space and with a steady flow of refreshments, a significant factor. So we have a very new, large and very pleasant rest area. Surveying on psychological safety, there's a great deal of methodology out there on that. Really, really helpful. Was quite, we sort of held back slightly in terms of doing it, because I think unless you've got the ability to respond, it's pretty appalling if you can't. So that hence engaging with the psychology support and a wellbeing team as well was key. So that psychological survey looked to the key areas that people could identify and the issues that were a particular matter for them. Looked at some of the impact, as Margaret points out, the home life aspects. Many of our colleagues' families had grave concerns about them attending work. or they had family members who were unwell themselves, or they had severe disruption in terms of their home lives, in terms of childcare, as many of the schools were closed in risk, and that just adds to matters as well. So getting that information together enables us to do some of the immediate stuff in terms of some of the immediate simple changes that made a difference, but also some of the longer term. So looking at our workforce plan. So this information, as well as the patient outcomes information, I think by example, I've recently taken to board and gained £4 million of investment in new workforce, so more workforce into the department. And that's been very much based, the board support understood the position in terms of the impact on staff, the risks to quality and the impact on quality. And I think taking that information in terms of was actually quite key in terms of that decision making. So has an effect within the local area, but also the bigger aspect in terms of gaining support for the wider actions. But there's a great deal out there in terms of psychological safety. I certainly encourage people to have a look at it in terms of are you using it? It does the consequences of ignoring it and on staff result in the harm to staff, but also to an issue certainly in terms of service quality that you're providing. So why is it that a doctor is rude to a patient? It is not, and I have rarely seen that it is a rude doctor. It is a doctor working in an unreasonable situation with unreasonable expectations. Other matters and things like psychological surveys help you to pick out some of these points.
So I'm going to come in a minute to Margaret about the point that Deborah Rees raises about what well-being plans are, but I just wanted to add one more thing. Of course, what makes the experience of your last 21 months is that you were needing to expose your staff to real trauma.
Yes.
I'm thinking about the time you told me when you had a series of people coming from the same nursing home.
Yes.
Who sadly left via the mortuary, and so you've had to take into account as ordinary business that you're exposing your staff to very, very significant trauma. But the point about the psychological surveys and actually being that no employer now should not be doing this kind of stuff. Doesn't matter what business you're in. Maybe in health we were more fluent in some of this language, and so I encourage colleagues to take this learning away. People either on this webinar now or listening to it later. So Margaret, do you want to talk a little bit about the wellbeing plans?
Yeah, can you hear me now?
Yeah, great.
Okay, so a wellbeing plan is an individualized way of recording those things that people themselves identify as being an issue, whether that's at home or in the workplace, and then co-creating, I suppose it's an approach to co-creating a plan that as an employer you support that person to fulfill. So one of the things could be that staff never get downtime during their working day, because particularly for some of my frontline teams, they are lone working and they work 12-hour shifts, and it can be very difficult if one of the people they're supporting is having a bad day to actually find time to get your sandwich and your cup of tea. So it's thinking about how, as an employer, we can enable them to do those basic things that keep us all well. With some of my other staff, it's been an agreement, and we've all signed up to it, not to have online calls between 12 and 2. So again, people can get that hour away from their computer, particularly if they're working from home. And certainly in the winter, that is vital to enable people to get outside. If there is, reasonable weather, have a walk, get some sunshine if there is any. It's just very practical approaches, but the fact that you write it down and together you identify what resources and different flexibility in the working day is needed to achieve it means it's something that you're more likely to stick to. And then I think the important thing is that you use that however you I'm going to use the social work term of supervision, whether that's clinical or not. But however you have one-to-ones with your individual members of staff to have conversations about how work is going, that you review that wellbeing plan. And it's a really good practice to do even when we're not in pandemic times. I think particularly as we come out of this, and there's a lot written in the media at the moment about the Great Resignation, and people have learned to value different things during the pandemic and are looking for something else from their work life and that home life, work life balance. I think having things like that on offer is going to make any employer a more attractive proposition than an employer that doesn't have that kind of approach.
So there's a good point made by Deborah, which in some of the people on this call, of course, their pandemic has been the obverse. So she writes, I completely understand why burnout in the NHS is a real issue, as the workload has been relentless for so long. In our organisation, however, we've had people not working for long periods of time. And whilst people initially expressed desire to return to work as soon as possible, some staff have found it very hard to adjust back to old jobs and seem less resilient. I think in a way that's a kind of a point you were making, Margaret, about, needing as an employer to understand what's happening at home as well. Have either of you anything to sort of say to that point? I mean, people whose stress has come from not doing anything and now needing to return to work.
Yes, about a third of our organisation homework during the pandemic, and numbers of them are still doing that because we've not felt as a board or a senior management team it's the right time to return them back. And they've approached it in different ways. Some people have found it stressful because they'd forgotten how awful commuting was, or they've forgotten how sometimes they're not a people person, which we're not all the same, are we? I'm quite happy, for example, working at home, and I can do tons of work, and I much prefer that to commuting into the office and then spending time having to engage with people. But that's actually part of my job, so I do it. But other people have got quite comfy working from home. I think it's understanding it's different for everybody, and how you for those individuals to get to a position where the organisation is comfortable with their working life and they themselves feel that they've been heard. They may not have the whole of what they've wanted, but equally they understand why maybe 2-3 days a week they do need to be in an office with their colleagues, because that is also good for them. So I think it's about communication, it's about careful planning, and it is about that conversation about what else was going on in their lives, because it will have been different. If you are a young single person, you may have been very lonely. If you had relationship problems and you've been locked down with someone that you didn't get on with or who was abusive, you won't have had a great pandemic. If you've been homeschooling children, or you've been a carer, your experience will be different again. So it is about contextualizing it and then going on that journey with the person.
Yeah, I mean, one theme that's coming out and certainly mirrors our experience is the boundary between work and not work, and what was proper as an employer to know or to not know, and has changed. So in a funny kind of way, I know the home circumstances of my staff much more than I would have really considered proper, but now I think as a group we've come to see is essential. And having to plan in routines to look after. So it's very, very conscious that during the pandemic, for some of our staff, fair slice of them are in London, they're young. Working from home meant working in their bedroom, and they came to London to spend all their time out and weren't able to do that. So I felt a moral obligation or GGI felt a moral obligation as the employer to go much further than normally an employer would to provide socialization, because for one thing they were socialized was through work. Many of our staff, I think about a quarter of them, actually come from overseas. Some of them haven't seen their families for a couple of years. So it's really just thinking about the context within which your teams are working. And I think that's no different if things have been really quiet. Maybe even it's exacerbated, or things have been very busy. So we're just coming up to the end. I don't know if there are any last questions people are curious to know. Let's just maybe end, if they're not, by a couple of tips. So if you can put yourself in the mind, James and Margaret, of instead of running a teaching hospital in an area where the population has grown as much as the population of Southampton in the last decade, and Margaret running your dispersed third sector organisation, looking after people in the way that you do. What you put yourself into the minds of someone running an arts organisation or on the board of an arts organisation, and maybe starting with you, Margaret, just think of two things that would be a tip and why. You're a reflector. She's a reflector.
I would certainly advise, particularly those smaller organisations that maybe don't have loads of money to throw at this, mental health first aid, because it is a cost-effective way of getting some of that support structure in that bigger organisations do have, and it works. It's proven to work. It's the gold standard for that kind of approach. And
we missed what it was. We missed what it was.
It's the short course that you can do that enables quality conversations and quality interventions around promoting mental well-being in your organisation. So I would certainly advise people to look at, go onto Mental Health First Aid England's website, then we can certainly look at doing that, and you can book on. There are courses all over the place, and very often organisations like ourselves will do cheaper courses because we cross-subsidise what we charge the private sector to enable smaller organisations to access the support. And the thing about that is not just to do the training, it's to stay in touch with the person or the organisation who trains you, because we can have an ongoing dialogue about what works and help when there are issues. And my other one is to just show people that you value them. And that can be done in so many small ways, but it really does work. Because I think one of the things that the pandemic has done is people to reconsider their values, and the kindness and telling people that they matter is so important.
Thank you very much. So the links Freya has very thoughtfully put in the chat for those the Mental Health First Aid England link course. James, what would be your two nuggets?
I think firstly is go seek and understand, is spend time with people. It's hugely valuable. Understand the issues that they're facing in their roles. As I've said, many of those things can be addressed in a very straightforward way. And other than that, you may need to get some support, so from an occupational psychologist or others in terms of that, but it's fundamental. And I suppose, and secondly, is the leadership obligation. Those as leaders, or those that lead larger organisations with a whole range, is absolutely be very explicit in terms of that absolute obligation, as well as running the service. But actually, the understanding the experience of staff within that. The comment about being less resilient coming back to work is absolutely key. That's absolutely implied in terms of a requirement as part of their leadership obligation to act on, understand and act on, and to have a range of interventions. And empowering colleagues. I've empowered a group of colleagues to work on well-being themselves, to come up with some of the interventions they want to. So I think it's understand it, and I think just making sure it's really, really clear within that leadership obligation is fundamental.
Yeah, I think so. It's a sort of new kind of compact, isn't it? I mean, mine wouldn't be so different. I mean, firstly, one of the things that I hope we've been at pains to not just tell staff, but to act in a way that's sort of backs this up. But there's no one who doesn't matter. Every single person on the books matters, and if you are in a leadership position, that does mean taking time and contacting people, and not only when you need to, not only about work, but finding time for thanking people for inquiring about how they are, and checking through, things that they've been worried about. So that's one. And the second, it was said earlier, is make people take your holidays. We, in hindsight, it was a mistake. In the first lockdown, we said, you can carry forward as much holiday as you like, because I thought, well, this is a bit raw to make people take a holiday when they're going to be locked up, not really understanding the psychological aspects of this, and it was going to go on and on and on and on, and the world would never be the same. But it is really important to give people that space. So I like your idea, Margaret, of no video calls between whatever the hours were at lunchtime. I know of other organisations that do that. I park emails and don't send them out in the evening, that kind of thing. And just to respect people's spaces and make sure that they take care of it. So, okay, I hope that was of some use and gave colleagues from third sector organisations in the arts an insight into what's been going on in two very contrasting healthcare organisations. Thank you ever so much, both of you. I know that you're very busy. It's really, really good of you. I know you both value the arts, and I think we should end the three of us with a sort of rousing clap to our colleagues in arts organisations. It's so nice that you're there.
Thank you, Andrew.
Absolutely. Thank you.
Thank you to all three of you. It's just wonderful to hear you talk, and there's lots for us, I think, in our sector to really learn. And what struck me about each of the bits of advice you just gave there was, of course, they're really applicable to those working in executive roles, but actually they're just as applicable to those sitting in governance roles. That ability to say thank you and to take people's time as a valuable resource and to acknowledge that. Really important. Thank you so much, Andrew, Margaret, and James. We've got one more session, which you can still go to if you want. It's on our main stage. That's with Cause 4 and Babylon Arts. That starts in about 1 minute. And don't forget, you can still use the networking area of Hopin to interact with other delegates. And we'll have recordings of this session with captions. Sorry, Margaret, there are some times when we'll need to caption you. They'll be available from next week. So thank you ever so much, all three of you. Thanks to all of the delegates in the space as well. Appreciate it.
Cheers. Bye-bye.
Bye-bye.